Welcome to Switch Point Essential, where we are going to talk about the healthcare workers. And we're not just talking about the healthcare workers in the ICUs and the nurses by the hospital beds, in the wards. We're not just talking about, the paramedics in the ambulances, but we want to touch on the families of these healthcare workers. We want to touch on the community healthcare workers, the ones that are walking long distances to get into people's communities to be able to deliver healthcare. We want to talk about, the whole ecosystem, that makes up global health. And so we're switching over to the switch point stage to essential workers to celebrate their tenacity, their strength, their creativity, their ingenuity, their ability to just come to overcome challenges against all odds. And despite of all of that, despite of even the toughest of times, as COVID-19 has shown us, also their joy. And COVID-19 actually has taught us all what the meaning of essential is. And that is what we're going to focus on today, the essential healthcare workers. I am a global health advocate. Absolutely no one should ever die just because they could never access a healthcare worker just in time. And no healthcare worker should die on the front lines trying to save our lives. And yet, for how many of you listening to this can relate to this reality that a lot of us in one way or the other have been faced with or have seen or, have read about, if you're lucky. When I first started a lot of my advocacy work for health workforce, one of the striking things that really made a lasting impression on me, and I will never forget this young student, was just talking to him, was recruiting students to study, clinical medicine, to be able to serve, especially in the rural and underserved areas where there's shortages of healthcare workers. And was asking this young man, I asked him, what is it that motivates you, to become a healthcare worker? And do you realize that most likely you might end up working in the rural, hard to reach areas? And so he narrated a story about him and his family leaving home around 3 o'clock in the morning, walking, passing through the hills, the hilly terrain, and it took them, you can calculate the hours, but I think he said that he left home around 2 o'clock in the morning, 3 o'clock in the morning. By the time they arrived at the clinic, at the health center, the nearest health center, it was around 7 o'clock in the morning. And there was such a long queue already that by the time that the nurse or the clinician at that facility actually came to see the sister, that was around 2 o'clock in the afternoon, and she died right there on the queue. And so this young man was determined to become a healthcare worker because he never wanted anybody to experience that in their lifetime. But also he often wondered, why is it that nobody ever wants to come and work in my rural community because it's so far, because there's no lights, there's no power, there's no electricity, no healthcare worker is motivated. And so I am training to become a healthcare worker just so that I could serve my community. And so we often hear of the stories of the women in the rural areas, again, who, because of their socio-economic and other challenges, are just not able to just take that many hours, to go to the clinic, and therefore rely on the community healthcare workers who come to their homes, visit them. And these community healthcare workers are faced with challenges, they have to walk long distances, the extreme weather conditions just to access babies born and young children, to immunize them, to just check on them and give them the essential care that they need. And so we also know, especially within the COVID-19 pandemic context, we've read and heard of so many horror stories actually of the clinicians and the medical professionals that really have essentially given up their lives. They've moved out of their houses and just separating themselves just because they don't want to infect their loved ones with the pandemic because they are on the front lines. We've heard recently, I think there was a number about 17,000, almost 18,000 healthcare workers that have just died from the COVID-19 infection themselves. And so we have these figures as well from the WHO that do project a shortfall of about 18 million healthcare workers across the world. And most of these will be needed, especially in resource limited context, where it's high disease burden and severe shortages of healthcare workers. And it's something that drew closer to home. I mean, I've seen this, I've watched this, I've followed and worked alongside amazing health worker professionals, very committed to their work, to saving lives for a long time. But just about, this must be like about 4 weeks ago now, 5 weeks ago now, my aunt, who was just very well, fine. And one of the mornings she didn't wake up feeling well. Of course, she had been complaining of a specific problem, and they took her to the hospital. But guess what? The time she arrived at the hospital is nothing compared to that young girl that died, that I spoke about earlier. But she arrived at the hospital. By the time it took for her to be seen by a medical professional, it was about 2 hours later, and she died right there in the car park, as the doctor was called to say, well, she can't even move. They had to come to the car, trying to get her out of the car. And as we taking her, they pronounced her dead right there. Because the healthcare workers, and we're not just talking about, the doctors and the nurses, but just nobody was there to attend to her. And I often wonder, and this is very painful, and it's something that I'm like, had it been that we had enough healthcare workers, enough staff to just rush there's a patient in a critical condition, to just rush and get her in and get her to be seen by a medical professional in time, would she have died or would she have been alive? I would never know. I would never have answers to that. But I think one thing I know for sure is that maybe if she was seen earlier by a medical professional, her life could have been saved. Who knows? And so there is so many stories, so many people who have lost their lives. And guess what? I really wish that on that death certificate, cause of death couldn't see a healthcare worker in time. And for those health worker professionals who have lost their lives due to COVID, the cause of death could be, there's just not enough healthcare workers in the world. And so despite what COVID pandemic has shown us about how essential and how critical this professional is, we're talking about life and death. Despite all of this, we're still not seeing sufficient enough action. I mean, clapping your hands at 7 p.m. for healthcare workers is nothing. I mean, that's what we saw. Communities recognizing that we have a key professional, I call them angels. These are special people, but just going out of their house at 7 p.m. to clap hands for them is not enough. We've seen political leaders addressing and saying, well, we will have to, a lot of promises, empty promises, but nothing still, despite COVID-19, is coming out from global leaders, from governments, from donors, from whoever, to just really put money and investments and effort towards where the mouth is, to really tackle this huge problem of the shortage of healthcare workers globally in the world. And so how many more babies are going to die? How many more mothers, aunties, how many more sisters, how many more brothers, how many more healthcare workers are going to die from cause of death, a lack of a healthcare worker, or I am a healthcare worker? How much more time will it take?